The other day, I found myself reading Dr. Teresa Tams' biography, her profile, on the Canada Public Health Agency's website, talking about the various titles that she's held, the positions she's held, and the publications and research papers that she's written for over the years. Pretty impressive list. Hats off to her, and no wonder she got the job. You know what I didn't see in that publication list, though? I didn't see that she had authored any sort of report or study or thesis on coronavirus, on COVID-19, for obvious reasons. Because this thing is brand new. We only realized it was around in December and early January when people started talking about it. So we can't blame anybody in the infectious disease community for not being an expert in this particular illness. Here's the thing, though. Prime Minister Justin Trudeau and many other officials out there are doing a lot of appeals on science, evidence, and the experts as they justify the various measures they're bringing into our lives to beat this thing down. Now, public opinion polls show that Canadians are largely in support of them. Leger showed that over 90% of respondents said they back these social distancing measures because we see there's a lot at stake and we certainly want to do things to protect the most vulnerable. I get all of that. But there's a little problem with these appeals to evidence and experts at this very moment right now when, and here's the thing that Canadian public officials are not acknowledging, experts are seriously divided over this all across the world. Within countries, even within different medical associations, there's disagreement as to the basic nuts and bolts of COVID-19. Just how deadly is this thing? Just how is it spread? We know more now than we did, say, back in the beginning of January, back on January 25th, when the first case in Canada was reported, but there are still many questions that remain unanswered. And part of the challenge is that there's a great certainty that comes from Trudeau, from Tam, from others, who one day suddenly say, travel restrictions do not work. The evidence tells us otherwise. Face masks do not work. The evidence, the science, says the opposite. No, they don't. Or at least some very temporary science that is only ironclad truth for about 15 minutes until new stuff comes along and we change gears. So I think that if there's one thing we could see differently right now, we don't want to be browbeating people about you must follow the science when the science is very quickly ever evolving. And there's a debate between virologists, between epidemiologists, between infectious disease experts about the very basics of this. Things are going to be changing day by day, week by week. That's okay because that is the nature of the thing. But I think Canadians should also be allowed to be a part of this conversation as they look around and assess what all these different experts are saying around the world. And is it okay for us to challenge our own public health officials based on our readings of everything going on around the world? You bet it is. It's all a part of the conversation that we're all going through together right now.